Hello and welcome to this month's Picture of Health. I'm your host, Lauren Lengyel. Breast cancer is the most common invasive cancer in women and the second main cause of cancer death in women after lung cancer. If you're worried about developing breast cancer, if you or a loved one is going through treatment, or if you're looking for more information about treatment options, then you'll want to stick around for this episode. Today in studio we have Dr. Polk Williams, a breast surgical oncologist from Heart of Florida Regional Medical Center in Davenport, who is here to help us learn more about the disease. Dr. Williams, thank you so much for being here.
Thank you for having me.
People think that they've heard it all about breast cancer, and almost it kind of even becomes like a tired subject sometimes, but just in talking with you before the show, it's this whole new renewed sense of, I want to know more.
Yeah.
So now a breast surgical oncologist is not something we often hear, so it's very specialized.
Yeah, it is.
What would be, there's a breast medical oncologist, and then what you do. Will you tell us a little bit about the difference between the two?
Yeah, absolutely. Breast surgical oncology, it's a big word. It basically means a breast specialist. We are general surgeons by training originally, but then after residency we do additional training, or we specialize in diseases and management of the breast. Some breast surgical oncologists do general surgery and they take care of breast problems. Other surgeons like myself, we are focused on taking care of breast problems only. And so basically we're the surgeon. We offer many different options. So basically if a woman finds a lump in her breast, we can work that up and go down the pathway and figure out what that is. Is it benign or is it a type of cancer? We typically do the biopsies for any problems of the breast if it's necessary. Not everything needs a biopsy. And we also do mammograms, stereotactic biopsies with ultrasound. And if it's benign or malignant, that kind of sends us down the next path, and the lady may require an operation of some type, and then we talk to her about her different options. We'll take her through the surgical aspect of this problem, if it's cancerous or if it's benign, and then we'll also guide basically where she goes next. Does she need to talk to a medical oncologist? And that's a type of doctor who, they're internal medicine doctors, who they specialize in endocrine therapy and hormone therapy, chemotherapy, or does she need radiation therapy? And we would make sure that she sees all of the appropriate specialists, because we know that breast cancer is treated, it's not just treated like it was in the early 1900s with one thing.
Right.
We have many different treatments for it these days, and that's basically what I do. We're kind of the conductor of any problem that happens to the breast.
Okay, so before we get into, I always like to have you kind of walk us through what it's like for someone who's, first coming into contact with you. But tell us what some of the risk factors are for, breast cancer in general.
Well, some of the risk, there are many different risk factors that we know of, and some of the risk factors a woman can actually modify. She can do something about some of the risk factors. Other risk factors for breast cancer you can't really do anything about. What we know is that one risk factor for breast cancer is being overweight. And what we recommend to our patients is that they can get online and they can pull up a calculator, a body mass index or a BMI calculator, and find out where they are. We kind of recommend a body mass index of between 20 and 25. And so if a lady calculates her body mass index to be 30 or 31, she should just start taking strides to bring that body mass index back down to anywhere between 20 or 25 or somewhere close to there. Increasing your consumption of healthy vegetables and fruits, it doesn't necessarily decrease your risk of breast cancer, but we always recommend it just to be, in general, a more healthy lady. And we also recommend decreasing your alcohol consumption to at least less than 1 drink a day. We do know that that does impact a lady's risk for breast cancer. Other risks that a lady can't really do anything about are if she has a very strong family history of breast cancer. Let's say she has 2 or 3 sisters that have had it, and maybe her mom and her aunt had it. Those women might be a candidate for genetic testing. And if you have a genetic problem, you really can't do anything about that, but at least being educated to know that a very strong family history should make you concerned that maybe you do have a genetic component. Another thing is that there are some things that will grow inside of a breast, some benign things that will develop in a lady's breast that you might find on a mammogram, and those are what we call high-risk lesions. They're not cancer, but once we identify them, we know that for some reason that lady's at a higher risk of breast cancer. Other than that, like I said, there's many things that a woman can do to decrease her risk, but there's some risk factors that she doesn't have any control over. But when a lady comes to see me, basically I take all of that information and put that into a risk model, and I basically give her I kind of let her know what her lifetime risk of breast cancer is, and should she be genetic tested or not.
Very interesting. I mean, you could get a lot of potentially heavy information in one visit.
Absolutely, yeah.
So what, in Polk County, what are some of the statistics that you see in people who have breast cancer?
Well, in Polk County specifically, it's very similar to other parts of the United States. What we know is that it's very surprising. You know, you'd mentioned earlier that breast cancer is kind of a overdone subject. But in fact, for me, you know, treating breast cancer every day, 1 out of 8 American women, on average, will develop breast cancer at some point in her lifetime and at some particular stage. That's 1 out of 8 women. And it turns out to be somewhere around a 12% incidence or chance of getting breast cancer. And so what we want to do is we want to educate the community to know that it's not something that you're exempt from. That every woman is potentially every woman has some risk. Many women live their entire life and never develop breast cancer, but every woman has a certain risk level. And that's why we encourage education. That's why we do talks like this, and that's why we also encourage screening for breast cancer. But in Polk County specifically, in general, women have about a 1 out of 8 chance of developing it in their lifetime at some point. We also know that there's about a 12% chance of developing breast cancer. We know that in Caucasian females, they typically develop breast cancer a little bit later in life, but we start screening at the age of 40 years old every year. In African Americans, oftentimes African American women will develop it at an earlier age of life, and so we're very careful with both of those communities to make sure that they both know where they are in the grand scheme of things. And we essentially start clinical breast exams every year, starting at age 30, and then we start screening mammograms starting at age 40 every year.
Now this may be a little off, but do men get breast cancer? I've heard many things, but
Absolutely. Men do develop breast cancer. Most of the time it's very similar to the same breast cancer that a woman will get. The difference in men is, number one, it's very rare. It only accounts to about 1% of all breast cancers are male breast cancers. If you diagnose a man with breast cancer at the same stage as a female, they'll traditionally do the same as far as their prognosis in the long run. The problem oftentimes with male breast cancers is that you catch it at a much later time. Men aren't that likely to go to the doctor for a lump in their breast. They think maybe they hit themselves on the cabinet or something like that. So it's very rare, but we do see it. It does happen. But it's treatable at a certain point for sure.
Wow. That's really something you kind of forget about, but like you said, it happens.
Yeah.
So on the preventive side of things, we talked about the risk factors. So how do we catch this early ourselves, besides our annual
Other than
visits?
like the risk factors that we mentioned earlier, you know, increasing, start to develop a healthy diet or a healthy lifestyle. And if you don't know what that is, you know, there's so many different websites these days, you know, look at it. And you don't have to, you know, go overboard with these things, but you can start making little slow strides, decreasing your body mass index, limiting your alcohol consumption, thinking about your family history. Do you have a strong family history of breast cancer? Or if you've ever been diagnosed with one of these high-risk breast lesions, see your doctor every year. We start clinical exams at 30. We don't really do regular mammograms in a woman in her 30s, but we do start at age 40. we may start earlier if she has a problem, if she comes in and has a problem. But what we know is the most important thing in a woman's overall lifetime that she can do for her breast is to have a clinical exam every year by a physician, and that may be a family medicine doctor, it may be your internal medicine doctor, your gynecologist, or a breast surgeon, as well as starting mammograms at the age of 40. There are 4 national recommended guidelines that recommend mammography or mammograms every year starting at age 40. 2 other national there's some debate out there on exactly what's the best plan, but in my practice we recommend mammograms starting at age 40. And what we know about mammograms is that if a woman is found to have breast cancer on mammograms, many times she's going to do much better than if a lady waits to have a lump in her breast. Because when you find cancer on a mammogram, typically it's very, very small, sometimes even microscopic, and very treatable at that early stage.
Is there a benefit to at-home or self-breast exams?
Well, many years ago, it was recommended that women do self-breast exams, that they examine themselves on a regular basis. And that kind of was removed from most of the national guidelines, and we don't really recommend it anymore for most women, because what it did was it really caused a lot of anxiety. It caused a lot of additional biopsies. You know, she would do these exams and she would feel something and it would panic her. So we don't really recommend that anymore. We will recommend self-breast exams for women who are at very high risk for breast cancer, such as women who may have a very strong family history, or if a woman has a genetic problem. We'll recommend breast exams to them. But in general, the general population, we just recommend clinical breast exams by your physician and get those mammograms every year because we know they save lives.
Absolutely. Well, we've got to take a quick break, but stay tuned for more information about breast cancer with Dr. Paul Williams.
In 1964, the first Surgeon General's report found that smoking caused lung cancer. Today, we know the impact of smoking on health and well-being is even worse than we thought.
We keep finding brand new diseases: diabetes, arthritis, erectile dysfunction, macular degeneration that causes blindness, all directly associated with smoking.
We see smokers being more absent from work. We see them saying their quality of life is not as good. And of course, this just continues on into older ages, where all these diseases that people get, sometimes even if they didn't smoke, become very common causes of death among smokers.
Since the first Surgeon General's report, more than 20 million Americans have been killed by cigarettes. Most were adults who smoked, but 2.5 million were non-smokers killed by secondhand smoke. And another 100,000 were babies who died from SIDS, prematurity, or other health conditions after being exposed to cigarettes either before they were born or after.
We know exactly what the future may bring if we don't act more aggressively. We know that kids will be addicted at an early age. We know that many of them will become adults who want to quit and become tobacco-free but can't because it's a devastating form of dependence. And then we know that they will fill hospitals with preventable illnesses and drive up healthcare costs and then lose years of precious life. So we know what the future might look like, and we have the power to change that. And it shouldn't take another 50 years to get to a society where we are tobacco-free.
This video is a production of the Office of the Surgeon General and CDC's Office on Smoking and Health.
In my family, there are a total of 6 women who've been diagnosed with breast cancer. My family history puts me at higher risk for breast cancer in the future. Things you can do to help lower your risk of getting breast cancer include exercise and maintaining a healthy weight, lowering your alcohol intake, and even breastfeeding your young infants. My family history with breast cancer doesn't predict my future, but it does help me make more informed decisions.
Welcome back to Picture of Health. In case you're just tuning in, I'm here in studio with Dr. Paul Williams from Heart of Florida Regional Medical Center, and we're learning all about breast cancer. So before the break, we were talking about prevention and how important it is to make sure you get those screenings. What happens when either you detect a lump or someone else detects a lump? What should they do?
Well, the first thing I just really want to get, I really want to make the point that before we talk about that, I'll get to that point, but breast cancer is, in general, so treatable. And a lot of times, a lady may feel a lump, maybe she hasn't had a mammogram, maybe she has had a negative mammogram, but she feels a lump, and the fear that goes through her mind, oftentimes, literally kind of, she will deny that and ignore it for a while. I encourage women, it's a fearful thing for a lady to feel a lump and to think maybe I have breast cancer, but I encourage you to go immediately to your family doctor, go to your gynecologist, go to a breast surgeon like myself, or a breast specialist, go to an internal medicine doctor, go be seen, because a lot of times that lump may be a benign thing. It's not always cancer when you feel a lump. It's fearful, and it oftentimes makes ladies not want to go because they don't want the diagnosis of breast cancer. They can't hear it, they don't want to have anything to do with it, and so they might deny it, may ignore it. But many times a breast lump may be nothing. It may be a benign thing, but you don't know until you go. When breast cancer is caught at its earliest stages, it is very treatable and in general very survivable. It is a survivable disease today. Some women still do die of breast cancer, and oftentimes those women are caught and diagnosed at a much later stage. So although fearful if a lady feels a lump, make an appointment with your doctor. It's probably been in there for a while, but it's not anything you want to let go and ignore. You definitely want to find out, is this benign? Is this cancerous? And the other thing is, I've had a lot of women who have felt a lump and they said, I didn't go to the doctor because I'm not having a mastectomy, ever. So I just didn't go to the doctor. Or I've had other women who say, I felt a lump and I'm not going to the doctor because if it's cancer, I'm not going through chemotherapy. I've had other patients who said, if it's cancer, I'm not going to have radiation therapy, so I didn't even go in. Unfortunately, that is the way that it was back in the 70s and 80s.
Oh, sure.
Every woman got surgery, every woman got chemotherapy. Most of the women got, they had a lot of treatment. And today, they still have, many women still have to go through those things, but not every woman needs a mastectomy. Many women can be offered a very minor day procedure where you just make a small incision over the cancer, remove the cancer, and oftentimes I'm able to even hide that incision in a normal body fold to where she's not reminded of that surgery in the future when she looks in the mirror. She's not reminded of having cancer. Other times women may not need chemotherapy. So I just encourage ladies to get those mammograms. If you get a mammogram and you feel a lump 3 or 4 months later, even if that mammogram were to be negative, I still encourage you to go and say, hey, I feel a new lump even though I had a negative mammogram, because we know mammograms are not 100%. They're very accurate, but they're not 100%. And so we've actually moved toward a new kind of mammogram today. It's called a 3D or a three-dimensional mammogram. And basically what it does, it picks up on more cancers than the old-fashioned mammograms did. So get the mammograms, get that clinical exam every year, and catch it while it's very treatable.
It seems so simple. If you applied this logic to anything else, you can't, if you had a pipe leak or something like that, and you knew it was there, if you ignored it, you would ruin your whole house.
Yeah.
But instead, we're very willing to fix a pipe leak.
Right.
But if we could just kind of apply that.
That's very true. It's amazing the wonderful women that I have encountered through the years who, for some reason, waited. They just waited. Maybe they never had a mammogram before. Maybe they skipped a couple of years. Oh, I'll be fine. Or I'm not getting a mammogram because I don't have any lumps in my breast. A lot of women won't get screening just because they don't think they have anything going on. But the issue is we don't want a lump in the breast. We want to find it when it's microscopic.
Right.
Even if you did have a lump, we still want to, check that out and see, if it's very small, it's still treatable. But I've had so many wonderful women through the years, for one reason or another, just let it go, not come in. We have resources available. It's not always easy to go to the doctor. Some women, you know, they may be a single mom, they have multiple kids, it's hard for them to get a babysitter, pay individuals with transportation issues. So there are some life factors that would cause you to not go to the doctor. But I just encourage you, you know, my ladies, I always call them strong ladies, my patients, because they, you know, they're in control of their lives. They've raised children successfully, they've had wonderful marriages, and they've taken care of everybody else. But when it comes time for them to take care of themselves, they're just not used to that. And so I really encourage you just to take care of yourself. Go get checked out, get that exam, come see me, come see any other doctor that you normally go to. Make sure you have nothing. Look forward to a negative mammogram. Look forward to that lump that you just found. Look forward to that being benign and not cancer, something else. But definitely go get it checked out, and I encourage ladies to do that and survive of this very survivable disease.
And on the other side, what you were saying about your patients that are undergoing treatment or what have you, that's a great crowd to be a part of, because the way you spoke about them, I love the way you speak about them. They're just these strong women who are, we're fighting.
Yeah,
we're gonna kick it.
I fell in love with oncology, or surgical oncology, back when I was in general surgery. I was probably a second-year resident, and the patient population, I don't like to call them patients, you know, they're my ladies. I treat them, they're my family. You have to, you know, in breast cancer or any breast disease, you have to treat these patients, these ladies, like your family. You can't, they're not a number. They're not going to be rushed in and rushed out. Number one, you have to have a good relationship with your patients. You need to be able to talk to them, but more than talk to them, you need to be able to listen to them and listen to what's going on in their life, and try to figure out how to help them. And so any breast issue is near and dear to my heart, because I'm going to make sure that it's not cancer. If it is cancer, we're going to develop a plan. We're going to talk to her. We're not going to force her to do anything she doesn't want to do, but we'll give her all of the information that she needs to make a very good decision on her behalf. We never really push anybody to do anything. And so if you're afraid of getting a mammogram, or if you're afraid of getting checked out if you have a lump because you're not going to go through chemo, not everybody needs it, you know, or I'm not having a mastectomy. Not everybody needs it. You know, just come and have an honest conversation, and I'll tell you. And we always lay those options out, because there are many different options for the treatment of breast cancer these days, thank God.
Well, tell me about them. You've got some special things going on at Heart of Florida Medical Center. Tell me about those.
I'm very, very thrilled to be a part of the Heart of Florida Medical Center. One reason is their vision is very much in line with my vision as far as taking care of patients. We really want to treat individuals like individuals with the utmost respect, keep our values high, and give the patients enough information to where they can make a good decision on their behalf. What we have at Heart of Florida Regional Medical Center with regard to breast disease is, one, we have moved forward with 3D mammography, or 3D imaging of the breast. We know that picks up more cancers than the old-fashioned mammograms, although if you're in rural Montana or wherever you are that doesn't have 3D mammogram, I still encourage you to get the old-fashioned mammograms. But if you can get a 3D image, that's what we recommend. That is basically the wave of the future with regard to breast imaging, and we do that at Heart of Florida Regional Medical Center. In addition, the way that I treat patients, most of the time, a woman with breast cancer will be offered one of two things: either a mastectomy. Sometimes she requires a mastectomy, but some women choose to have a mastectomy. And the other option is when we save her breast with a very small incision on the breast. What I do is I always, you know, many years ago, cosmetics across the United States was not a part of the treatment of breast cancer.
Right.
Women who went through breast cancer in the 80s and 90s, and even some parts of the U.S. today, the surgeons don't consider cosmetics as an important part of her treatment. Every woman I see with breast cancer, or who needs any kind of surgery, maybe she needs a benign tumor taken out of her breast, is considered in my mind a woman who I need to think very carefully about on how to give her the best cosmetic outcome. So today, it's very important to think about the cosmetic outcome of what you're about to do for the patient. And so I consider every woman as a candidate for an excellent cosmetic outcome, and I do my very best to make sure that she is happy with the surgery and the final result. Because, you know, self-image issues come up after a woman goes through breast cancer. There are emotional difficulties, there are self-image problems, and so that's one thing we do, and I often do, I try to discreetly locate or place my incision so that she's not reminded of that every day when she looks in the mirror. The other thing we do is that for many years, women with a tumor in the breast, they would place this wire into the breast. It's a pretty long wire, and the lady would lay there before surgery with this wire hanging out, and the wire was intended to help the surgeon find the tumor. They would have that placed before surgery. We don't use that anymore at Heart of Florida Medical Center. Basically, we use a very, very small, it's about the size or smaller than a grain of rice. Before surgery, maybe a week before surgery, our radiologist will place this little seed inside of the breast. It's a radio frequency seed. And she goes home with a Band-Aid on her breast. Wow. Minimal to no pain. And the day of surgery, she comes in and she's not laying there with a wire, you know, hanging out of her. It's just a small seed, and I'm able to take a small probe and find that little seed, and that helps me find the cancer, or it helps me find the benign tumor that she has. And because of that, it really helps me be able to hide that scar in such a way to where she doesn't have to see it. It's a lot more comfortable for patients. Sure. And that also is the wave of the future with regard to our improved technology in finding these tumors. In addition, it helps me be more precise with taking these tumors out.
So we're almost out of time, but what is, I guess, the most important thing that you want to leave with our viewers?
Basically, to recap, I encourage our viewers to start getting a clinical exam at the age of 30 every year by their doctor, family medicine, internal medicine, gynecologist, or a breast surgeon. When you turn 40 years old, I encourage ladies to get those mammograms. They save lives and they catch breast cancer at such a treatable stage. If you feel a lump, go get seen. Don't ignore it. Don't leave it. Go find someone who will send you where you need to go, because it may be benign. And it may be a cancer, and if you catch it at a certain point, it's so treatable. And in fact, most women these days are able to be treated with breast cancer. Women are living longer than they ever have in the history of humankind these days with breast cancer. And that's very encouraging that we're doing such a great job with them. Find a doctor, find someone that you feel comfortable with, that you can talk to, and make sure that you're able to have open lines of communication, and that he or she will treat you well.
That's it. That's the key. And you know, I would add that you find a physician who's as caring as Dr. Williams, because he really kind of exudes that. So hopefully you'll get yourself to a doctor if you need it, and treat this very, very treatable illness, or treat whatever non-malignant tumor you might have. So, Dr. Williams, thank you so much for being here.
You're welcome. Thank you very much.
It's been a pleasure, and best of luck in everything you do.
Thank you. Appreciate it.
Unfortunately, that's all the time we have for this month. If you'd like to catch this episode again, you can tune in to PGTV on Tuesdays, Thursdays, or Saturdays at 2 or 8 a.m. or p.m. You can also find this and all of our previous episodes on the Polk Government YouTube channel. I'm your host, Lauren Lengyel. Thank you for joining me on this month's Picture of Health.